I will open with the line that I will start with the line that is most often heard in those events nowadays. Good morning, good afternoon, and good evening, everyone. Before formally opening the event, I would like to highlight a couple of housekeeping issues. We are in a webinar format, so the audience can participate in the conversation by providing comments via chat function, or if you have any questions, you can use the Q&A functions, and both of them are at the bottom of your screens. And my colleague Sigrid will be monitoring them, and then we'll bring some of them towards the end of the session. And we also took note of all the questions that were left at registration, so thanks for that. This event is recorded and live streamed. So let's get started. Excellencies, colleagues, friends, on behalf of the three co-hosts, the Dag Hammarskjöld Foundation, the Permanent Mission of Bangladesh to the United Nations, and the Permanent Mission of the Republic of Korea to the United Nations, I have the honor and pleasure to welcome you to this official side event during the 2021 High-Level Political Forum, as well known to your as HLPF. This event is also supported by the Center for Reproductive Rights. My name is Majka Grzybnowicz, and I work as the program manager covering the 2030 agenda at the foundation. As we all know too well, 2020 was an extraordinary year in our history. Not only were we hit by the COVID-19 pandemic, but it also became very clear that we were not on track to meet our commitments of the 2030 agenda. It is, however, important to recognize that before the pandemic hit, there were some modest gains that had been made in reducing inequalities in some areas. Not enough, but still. Now the pandemic is exacerbating existing inequalities within and among countries and hitting the hardest people who have been already in vulnerable situations, and also the poorest countries. UNDP has repeatedly highlighted that to build forward better, we need to start using the SDGs as the roadmap. I would like to also add to that we need to remember the promise of the 2030 agenda. We were supposed to transform our world. And COVID-19 is giving us a chance and forces us to profoundly rethink the how of transforming and how of building forward and doing it together in a better, more inclusive and sustainable way. Ipsos survey released in September 2020 for the World Economic Forum unveiled that 86% of respondents would prefer to see the world change significantly and become more sustainable and equitable, rather than go back to the status pre-COVID-19. In other words, we need a systemic change, and we should start doing it with the recovery. So in this context, we will look at how traditionally marginalized populations have been affected by and participated by the COVID-19 response efforts. We will also assess how national COVID-19 response policies have served to overcome, maintain, or exacerbate inequalities, as well as what the role of UN has been in supporting such efforts. So to start the conversation and the discussion, we have two distinguished guests who will provide opening remarks. And I will start with Henrik Hammargren, Executive Director of the Dag Hammarskjöld Foundation. Henrik, there you go, you have the floor.
Thank you very much, Majka, and good morning, afternoon, evening from me as well, and greetings from Stockholm, Sweden. My name is, as said, Henrik Hammargren. I'm the director of the foundation. It's my sincere pleasure to be part of this whole HLPF side event. It's extremely important from our perspective, but that is very small compared to what this actually is about when you look at the populations affected. Having sort of listened to Majka's introduction, I need to cut myself a little bit short in order to not repeat what has already been said, but we are extremely proud to be doing this together with the Republic of Korea and Bangladesh, of course. And we also have a very impressive lineup of discussants from civil society, research institutions, government, and the UN. So I'm very grateful for everyone that has joined us for this discussion. So let me just start by thanking you, Micah, actually for taking the initiative and making this happen. It would not have happened without your extremely sort of forceful leadership in this issue from us within the foundation. I'd also like to thank the co-chairs of the group of friends of SDG10. I think it's really important to recognize the development of this friends group. I think it's now up to some 22 countries. I want to turn to the ambassador to speak more about this. For those of you who do not know the Hammarskjöld Foundation, we are an autonomous, non-governmental and non-grant giving organization that was established by the Swedish Parliament. And we work to advance dialogue and policy for sustainable development. And we also are very much focused on peace and building on Hammarskjöld's legacy. We have done a lot of work together with member states, and I'm also very glad to having this opportunity to continue to build upon a work we did together with the Republic of Korea on a regional consultation on sustaining peace that was held some years back. And in that area of building and sustaining peace, we have for a long time focused on inclusivity and the need to make sure that peace building efforts are focused on peace building. In that work, and similar to this discussion, we've come to realize that inclusivity is often recognized but not realized. Without going into the details of where we stand with goal 10 right now, but also perhaps underlining instead the necessity to realize that if we're in the decade of action, it's really becoming a risk of becoming of a start in this decade of inaction due to the pandemic. And one of these areas that are most challenged at this stage is actually inequalities, because we see a very rapid change in that dimension of the SDGs, both goal formation, but also goal targets. We need to focus not only on inclusion, but actually exclusion, which is at the very core of this. And therefore, I think this discussion that we're having today is really important. So without going into further details on the discussion we will have, I want to say that for me personally, it is a discussion that I do not see happen at the levels or at the frequency that it deserves attention. So therefore, it is our ambition with this side event to continue a dialogue. We would also like to do some sort of a write-up. I don't want to flag up too much of so that there will be an official report, but we will turn to participants after the high-level meeting and continue and document this process, taking it further forward. Instead of going through more details of a presentation on this, perhaps I should try to make an effort actually turning this into a formal but still a very open discussion, and where we can use our sort of first name and goal a little bit less formal, although recognizing with respect that this is a formal side event. So with this, I'd like to turn to the Ambassador Cho Yoon of the Republic of Korea to present an introduction from you as a co-chair of the group of friends of SDG10, and then we can come back a little bit more onto the details from our perspective of the foundation, should we have time in the moderated session of Q&As later. Again, thank you very much, Micah, and over to you, Ambassador.
Well, Mr. Hammargren, sorry for all these technical difficulties I face now, but I will speak now. Ambassador Fatima, distinguished speakers and participants from all around the world, good morning, good afternoon, and good evening. I warmly welcome each and every one of you to our HLPF side event today. Today, we will be discussing how to address inequality, which is arguably one of the most crucially important issues in the COVID era and beyond. Indeed, the pandemic has been so merciless in magnifying deep-rooted inequalities that had existed in our respective societies, as well as in the international community. At the global level, while the developed world spent trillions of dollars on stimulus packages, many from the developing world have been shackled by falling revenues and rising external debt obligations, further depleting their resources to invest in the SDGs. And even worse, we have been witnessing how vaccine inequality has been leaving the developing world further behind, where extensive vaccination still remains elusive. Even within countries with substantial stockpiles of vaccines, there are also reports of gross disparities in access to vaccines among different groups and marginalized communities. Distinguished participants, realizing an inclusive recovery is not merely a test for humanity's solidarity or morality. It is also a question of enlightened self-interest. Indeed, growing inequality leads to a significant increase in social unrest, which in turn damages economic stability and resilience. Decreasing economic growth further worsens inequality, which creates a vicious circle where every member of society suffers. An even grimmer scenario, however, would be one where inequality contributes to a demographic disaster, as in the case of my own country, Korea, for example. In fact, Korea has been experiencing one of the lowest birth rates in the world, despite its per capita GDP steadily increasing. Many experts, therefore, started to look at this issue from the perspective of inequality. That is, people decide not to have a child when they believe that their child would not be able to enjoy opportunities for a better life than theirs because of social immobility and structured patterns of inequality. Distinguished participants, in the face of these daunting challenges, it is important that we do not lose sight of and keep focus on our vision of leaving no one behind. For our part, the Republic of Korea has launched the Korean New Deal as a nationwide recovery strategy where strengthening social safety nets is the foundation of a green and digital transition. As such, our journey towards building back better and more equal has just begun, and we are ready to learn more from our colleagues and partners, because we need to be inspired by others, and it is easier said than done. In this regard, it is my great hope that today's timely event will serve as an opportunity for collective learning. I particularly look forward to hearing from our impressive speakers who will bring us to a wide range of experience from Parliament, international organizations, academia, and civil society. I thank you.
Thank you so much, Ambassador, for your opening remarks and also putting us in a very clear context. And I really would like to highlight what you said about even that it's a daunting challenge, we cannot lose focus on our mission to leave no one behind. And as well, I hope this will be a very good learning opportunity for everybody. So thank you so much, Ambassador, and thank you, Henrik, for getting us started. So as you could see from our program and a flyer, our panel is composed of brilliant speakers. They have different institutional backgrounds. They have different fields of expertise. They will bring nuanced perspectives to the topic of today's discussion. And also, they are based across six different time zones. So thank you for waking up really early or staying up long after your bedtime. And I know that you were there because you are so committed to the discussion. So thanks a lot for that. So I couldn't be more excited to introduce our first speaker, Ulrika Modier, who is the Assistant Secretary General and the Director of Bureau of External Relations and Advocacy at UNDP. Thank you so much for joining us. I wanted to start with a quote that demonstrates so well UNDP's approach to the pandemic and the recovery. To quote, "At UNDP, we are not focusing on getting back to the normal world of 2019, but on a transformative recovery to help create the future set out by the SDGs. One that doesn't separate growth from inequality or health from systemic racism." And I think this fits perfectly to this event, and hopefully this will be picked up for our approaches. So now, to the question that I would really like you to reflect on. The global recession caused by the pandemic is expected to result in major cuts to ODA, the official development assistance. And understanding that available resources may not be sufficient to address all the development needs, how can the UN maximize financing and channel it toward recovery efforts aimed at reducing inequalities? And if you have any tools or mechanisms and approaches that support an equitable UN system response targeting those most at risk of being left behind. Ulrika, you have the floor, please.
Thank you so much, Mika, and thank you for the opportunity and for all of you listening into this conversation. And I would like to say, as the ambassador, let this be a learning session, but let also see to that all of us and the increasing number of both organization and people understanding that increasing inequalities across and between and within countries is actually a challenge to the sustainable future that we have promised to build, come together in learning throughout the years ahead of us, because we have a bumpy road ahead of us. And Mika, you asked me to speak about the UN system perspective about two topics, both how we address inequalities through the recovery, and then the challenges of financing the recovery and also the sustainable development goals. And this was also addressed by the ambassador, saying that different countries certainly have different opportunities or lack of opportunities doing so. And how can we then as an international community come together and use also the United Nations Development Program present in 170 countries as that strong learning network. It has also been said in the introduction, but needs to be said again and again, that COVID-19 has really exposed the cost of the systemic and interconnected risks that we have ignored for decades, deepening inequalities and humans pushing against and carrying capacity of the planet. For the first time, and this is what we have seen and reported also as we follow this in our Human Development Report, global human development has declined as we look back since 1990 when we started to measure 30 years ago. And what we see is that there is no post-pandemic reality on the horizon for most countries in the world. I think that this is a very important reminder for countries that are now moving out of the pandemic situation and that have been able to uphold economies, even though also facing difficult times. Rather, what we see is that there is a rapidly evolving pandemic deepening its hold on the most vulnerable countries and communities. And the choices that we make today will actually define whether the story we tell of the decade of action is a decade of action or a decade of loss. We need to turn the trends around. So of course, then the question how to recover from the pandemic in a way that actually puts the most vulnerable at the center of development is exactly the challenge that we started to discuss as we embarked on the road towards the Agenda 2030. This is what the SDGs was actually made for, leaving no one behind. And UNDP's research, and I'll see to that we can put some links also online, suggests that we, with a concerted push towards the Sustainable Development Goals, as Mika said, using them as the roadmap could actually push the world slightly closer to achieving the SDG 1 on extreme poverty than it was in 2019, in spite of the pandemic. Choices matters. As a UN system, we have been reflecting on how to best rise, of course, to the challenge. And to date, we have, as UNDP, supported 150 socioeconomic impact assessments in the 5 regions, often jointly with international financial institutions, the European Union, and other development actors. And 139 countries have UN socioeconomic response plans now in place. And of course, the way we design them matters. And we see 3 big shifts as essential to achieve the integrated impact that we need to see at scale. First is about unblocking the very specific fiscal, political, and institutional constraints that slow progress at country level. And we need to move our leave no one behind and equalizing strategies. We are talking about climate promises, integrating the NDCs into the response plans. We're talking about social protection floors, being ready in the midst of the crisis to actually invest in systems that we can build and that can respond on a long-term basis. We're talking about universal healthcare proposals, systems that we can try out in different ways in different countries, where we can use UNDP's experience together with other partners as this learning network that we have mentioned. And we need to invest in the transition also to a carbon zero economic model. And this needs to happen in parallel. And there are possibilities to open up fiscal space and reinvest in, let's say, social protection. Secondly, creating SDG policy space in every country means, of course, then looking at how to expand fiscal space and addressing also the debt standstill and preparing also for debt restructuring. It's way more complicated than it used to be, but we need to look at this, and it also needs to be at the center of the discussions. And here the UN have come forward with new bold ideas that needs to be at the center of the discussions. Now, third, also beyond fiscal and financial constraints, we need to demonstrate that we can move the needle on some of the most challenging development settings. Poverty and basic services also in LDCs, food and energy transition in the SIDS, livelihoods and jobs in fragile country settings, because of course, in parallel with everything we see now, we also have a situation with an increasing number of conflicts and protracted crises across the world. And we also need to look at how future-proof our interventions are and how they address core issues, of course, at the heart of UNDP's response as well, such as governance, social cohesion, rule of law, human rights, and gender-based violence, as we also see that these issues are also challenged by the socioeconomic problems that many countries and communities are facing. I'm really looking forward to hear also about the experiences from all the contexts and institutions represented in this call today. From UNDP's experience, let me just underline that bold policy choices and strong data is needed. And we need to focus, as we're doing here today, also on the discussion on how to find new ways of financing. We really need to build inclusive and gender sensitive evidence on the multidimensional challenges facing most of the vulnerable countries and communities, so that we can adequately cover also the needs in strategies going forward. Continued utmost priority needs to be given to the identification of gender and leave no one behind, so-called blind spots also in our analysis, as well as in our policy response. So accompanying also the recovery plans, looking at with these lenses at what is actually happening is incredibly important. Now, just finally also, the issue on financing. The challenge, of course, is to align our economies to the Sustainable Development Goals and to the Paris Agreement, reducing inequalities. And I think it was mentioned also by the ambassador in his initial remarks. just 1.1% of the US dollar, 379 trillions in global financing assets, including cash, bank deposits, bonds, stocks, is actually enough to see to that we can close the financing gap. There is not a lack of funding. There is a lack of understanding that we need to address the funding in a different way and move towards impact investments in line with the Sustainable Development Goals. As the UN, we have of course worked to support the right incentives for the allocation of financing by public and private actors where it matters for the Sustainable Development Goals, both with regard to geography, but also in investment areas such as renewable energy and social protection. And we're of course then also trying to, as I said, to discourage investing which creates negative SDG externalities, such as fossil fuels or let's say also other areas. To support investors, bond issuers and enterprises to make measurable contributions towards Sustainable Development Goals, UNDP has developed a really interesting project. It's called the SDG Impact Standards for private equity funds and bond issues. And it's also now being developed as enterprise standards. And these are actually used now in the market. The new development bank in China announced a 5 billion SDG bond issued utilizing the standards and the SDG finance taxonomy. And we're working with a broad range of partners across the world now testing this, making also use of the data, the maps that we can do at country level also to support bankable projects and see to that there is a conducive environment for these kind of investments. Because, of course, there is not one size fits all, we are also supporting governments in 72 countries to put in place holistic financing strategies, and they are called the Integrated National Financing Frameworks, the INFFs, decided upon as we decided on the Financing for Development agenda, and with the idea then to align both public and private and domestic international finance with the Sustainable Development Goals. And here there is a really good partnership between the UN, UNDP and the EU and an increasing number of actors. So I also urge you to look closer into the INFFs, and I can post a link for you to do so, because we believe that this framework can also be a conducive framework. We're also assisting countries to develop productive capacities in areas such as energy, infrastructure, market interlinkages, and private sector development to enhance the social development, returns of economic growth, and accelerate also the structural transformation that needs to take place. The digital economy becomes increasingly inseparable from the functioning of modern economies, and we are also doing a lot of development in our support, not least to least developed countries in their digital transformation. And we're working with SIDS economies such as Cabo Verde, who are reliant on tourism to build sustainable and resilience in their blue economy and tourism economy. And we're also supporting vulnerable countries in the shape of SDG financing needs into financially sound and also attractive business propositions, as I mentioned, to see to that there is market intelligence through these SDG investor maps that I mentioned. And more than 200 investment opportunities in 12 countries have already been made available as part of these SDG investor platforms. So driving investment in many different ways is important, and turning words into action and showing that this can happen. As we see a possible decline of ODA, we need to use ODA in a clever way to see to that we can also leverage development finance in new ways. I'll post some links, but handing back to you, Marta.
Thank you so much, Ulrika, for this. And I mean, I'm not even trying to summarize what you just said, but I wanted to highlight a couple of expressions that I think are important to keep in mind as we go forward. Bold policy choices and strong data. And we will get back to data in a bit in our conversation, and that our strategies need to be future-proof. So I wanted us to keep that in mind as we go forward and share further. So now, going to the next speaker, I have the absolute pleasure to introduce Dr. Elizabeth Kerekere, who is the Member of Parliament of the Green Party of Aotearoa, New Zealand. And first of all, I wanted to say happy Matariki, happy Maori New Year, that I know you were celebrating last week. And Elizabeth, New Zealand is seen as a success story in terms of the response and being able to limit the spread of COVID-19. If you could share with us what was the strategy that was used and how was it ensured that equity considerations were integrated across the response efforts? And also if you could focus specifically on measures that have been implemented or should be taken to ensure that the Maori and LGBTI communities were included and protected by recovery efforts. The floor is yours.
Rookie mistake. Kia ora, everybody. Greetings from Aotearoa, New Zealand. I'm one of the people who are staying up late to share this space with all of you. So I want to acknowledge the range of cultures represented here. I want to acknowledge your ancestors and the sacred spaces of your people. I'm a Māori person, Indigenous to Aotearoa, New Zealand, and a long-time activist, particularly in rainbow communities. New Zealand, we made some decisions very, very quickly. We decided early to close our borders, even though we only had a handful of cases. We only allowed New Zealanders to come home. We also decided on an elimination strategy. We decided that we didn't want any deaths. We wanted to shut this down in our country. So we had to set up MIQ, we called managed isolation and quarantine, so that anybody coming here had to stay at least 2 weeks away from everybody else. We created alert levels. So level 1, which we're always in, which is that our borders are closed to anybody except our people coming home or people who are coming here to work that have been meet the criteria. Level 2, some restrictions. So for example, only 100 people at any kind of gathering. Level 3, more restricted. And level 4, complete lockdown. And so once we started getting people coming home and bringing COVID into our towns, our government shut down the whole country until 2 weeks after we had no community cases. So we got to a point where we said, there is no COVID here, except what's coming through the border. In total, we've had 2,764 cases and 26 deaths for a population of 5 million. The last death was in February and the one before that in September of last year. There have been times, though, when people say they were tested negatively in MIQ, but they've come into the community and then they've started spreading, or people have not followed the rules and they've had we call them super spreader events, where they have decided to hold a church service, or they had a party, or did something where they weren't following those rules, and so then it got out. But as soon as there were 3 cases at one point, and we shut down our largest city, and we was like, no, we're getting rid of this. And each time we would stay locked down until we're certain that it had stopped. I work in the capital, working at our parliament, and we had 1 case. Somebody came here on holiday from Australia and left again, and when they got back to Australia, they tested positive. They shut down our capital. And so when I say shut down, it meant that we went into alert level higher than the one we normally are in. But we take it very, very seriously. We decided to get the highest quality and the most effective vaccine, which we believe to be Pfizer, and so that's rolling out across the country at the moment. In terms of Māori in particular, who we have the worst, absolutely worst statistics, which of course is typical of Indigenous people in settler colonial countries. So we know that for health, we have, no matter what the disease is, no matter what the condition is, we have the worst statistics in it. So we knew that if COVID got into our country, it would be our people who would be impacted the greatest. And so there was a lot of push from our, through our cultural organizations, through our health providers, to make sure that our people were kept separate and catered for when all these decisions were being made. We have an Associate Minister of Health who deals specifically with Māori health, and we have Māori people throughout our district health boards, which is the unit of organising in our country. It still wasn't enough. We needed to make sure if we were going to get people tested, if we got people signing up to our contact tracing apps, and now in the process of getting vaccinated, that government realised very quickly that they had to connect in with our local organisations and the people on the ground to get to the people, because our conditions weren't great before COVID. And as other speakers have said, the economic situations, the lack of income, the fact that many of our people live below the poverty line, all those things were already happening. And of course, COVID made it worse. So we have done incredibly well in terms of saving lives. And of the only 26 deaths, which was despite having outbreaks in 3 retirement villages, we still managed to look after our people. However, the fallout from having such extended lockdowns has been considerable. The bulk of the jobs that were lost were jobs usually done by women. They were part-time, they were care work, hospitality work. And so women have been unreasonably, disproportionately affected by the decisions that were made. We also saw that when the funding was made by government to recompense people who were now suddenly out of work, they put in a higher amount than what our normal social welfare payments were. And so this immediate 2-tier system arrived where the predominantly Māori people who were on benefits were living on a much lower income, but the people who had jobs, because apparently more important, they automatically got more money. And so things that were already not great, again, made worse by the financial decisions. And then the funding that was put into our recovery, despite the fact that it was mainly women who lost their jobs. And when I say women, I'm talking about that absolutely includes trans women and intersex women. It includes a lot of our non-binary people. I go to say whānau because we refer to them as our family. The money that was put into new jobs was predominantly in fields which favoured men, traditionally male industries. So it wasn't great before. We put things in place, made it worse, and we're still seeing the impact of those things. However, we often, as Māori, will just take things into our own hands. And amazing things that we saw happen throughout. One of them was the place that I live in is quite a remote area. And so we've got our main town, Gisborne, where I live, and then we have this whole coastal area, very secluded, but the people up there are much more likely to get sick, much more likely to die if they get sick. So our people put in roadblocks. And it was fantastic. They would stop every single car because there were times when no one's meant to travel and people were traveling because they wanted to go to the beach. And so they actually just stopped every car and said, you need to prove you live here. And if you don't, you can't go. And of course, the police were not happy about this. And they did mention to our people that they should really stop doing it. They kept doing it anyway. And so because of those health issues, because of the disparity and of course the racism, the systemic racism that's just all part of that, the police eventually actually came round and supported them and said, actually, you're doing what we need to do, but we have no capacity for it. And so it was just one of the ways where our people just stood up and said, no, if you cannot look after us properly, we will look after ourselves, and we will fight with the police and we'll fight with anybody to make sure this happens. The other thing that was happening in our cultural centres on our marae and in our ancestral meeting houses, our people started organising. We did rosters to make sure that calls were made to all our elderly, to make sure that they were all right. They got checked in with them every single day. They collated and got donated food, made up packs for them, or leave them outside their doors. And so it's just those things, because if you don't have those people on the ground, then all of those people become invisible and they don't get looked at. In some ways, because Māori have the worst outcomes, we're always getting talked about. Doesn't mean we're in the proper decision-making places. For rainbow people there, for our LGBTIQ whānau, it was much, much more difficult. And there was, I don't believe anything was in place that allowed that voice to be heard. And despite the fact that we have high numbers of rainbow people in our parliament and very high profile people in the community, it wasn't a big topic. But what we saw again is our rainbow organizations taking the initiative and saying, right, fine, we'll just get on with it ourselves again. And they would do things, same thing, they just went online, especially our young people, they led in this area. They would contact all of their people, the people in their youth groups that could no longer work. And of course, we saw huge issues with mental health, with people who couldn't get out to people who they felt reflected themselves. Quite often people were stuck in homes where it wasn't safe and they didn't have a lot of options for moving out of that. And that was the awful thing, the hard thing about lockdown. But we saw that our rainbow groups stepped up into that space and made sure, tried to keep in contact with people, always been a listening ear and taking note of who was there. A last thing I would say is New Zealand has a clean green image, but we do have significant issues about destruction of habitats, exotic plants taking over natives, all sorts of things that happen here. Too much focus on developers and giving resource consents to people who are going to, for now economic recovery, bring money into the region or create jobs, but actually they're destroying habitats and they are not actually giving jobs to the people who need them. What we saw is in those areas around the environment, like most parts of the world, we saw beautiful things happening where people are getting out. When they were allowed, we're all allowed to go for walks in our areas when we're on lockdown, but the return of bird song in places that we didn't have. And so for Māori, these are the practical things about our own health, but actually as Indigenous people, our connection is to the land and to our spirituality. And that includes our connection to our birds, to our fishes, to our, to the land, to the sea, to the sky. And COVID provided us opportunities, to experience cleaner air, safer spaces for our birds, but it strengthened our connection and enabled us again to have greater leadership in areas that are important to our culture and to our people. And I think I will leave it. I have no idea how long I've been talking, so I will leave it there. And thank you so much for this opportunity to be part of this amazing crew. Kia ora.
Thank you so much, Elizabeth. That's why I came online to show myself, but the discussion is so rich, I don't want to break it. So I loved, hearing what you said, and bringing up those different, both strategies, but challenges, and how, communities took the response and solutions in their own hands, both that you shared, from the Maori and LGBTI. And I mean, that's where the strength is, right? We know what we need. So thank you for sharing that. And we will get back to more in the discussion section. So thanks so much for now. And now we will move to another region, actually. I would like to bring into the discussion Carmen Cecilia Martinez, who is the regional manager for Latin America and the Caribbean program at the Center for Reproductive Rights. And for those of you who do not know the center, it is a global human rights organization of lawyers and advocates who ensure that reproductive rights are protected in law as fundamental human rights for the dignity, equality, health, and well-being of every person. So welcome, thank you for joining us, very early morning. So Carmen, you work on the intersection of gender and access to justice, and as well as focus on young women and girls and young people. Could you tell us about your work on monitoring of how COVID-19 pandemic impacted access to sexual and reproductive health and rights for young people in the region that you are based in? The floor is yours.
Yeah, thank you very much, Maika, for your question. Good morning, good evening from Colombia. I will try to respond very briefly. So regarding your question, specifically in our Latin America and the Caribbean program, given the alarming incidence of sexual violence against girls and adolescents and denial of their sexual and reproductive rights, we have made a priority our work regarding girls and adolescents. So in that line, with the specific focus, and in order to highlight and denounce this systemic problem in our region, the center with different partners around Latin America initiated a landmark action in 2019, and we presented 4 individual communications before the United Nations Human Rights Committee against 3 different states, Ecuador, Guatemala, and Nicaragua. These 4 cases allege the human rights violations suffered by 4 girls who were victims of rape when they were all under the age of 14. So, unfortunately, as these problematics has been exacerbated during the pandemic, we started to monitoring the cases of sexual violence against girls and adolescents that occur during confinement, as well as the situation of sexual and reproductive health and rights, in particularly the denial of access to the essential safer services, even in cases of rape. So, product of this monitoring, last year, at the end of the year, we asked for a thematic regional hearing before the Inter-American Commission of Human Rights, which focused on this matter, sexual violence, forced pregnancy, and access to health services in the context of the COVID-19. So the hearing was an opportunity to present independent and updated information that we and our partners had collected, especially on how in Colombia, Ecuador, Guatemala, Nicaragua, Peru, the incidence of sexual violence and denial of sexual and reproductive services had been exacerbated, and how this is having also a differentiated impact on girls and adolescents in situations of vulnerability, including those from historically discriminated populations, such as indigenous and migrant girls. During the hearing, we call on states to ensure that their responses to the problem at the regional and national level not only had to be immediate, but also should include a comprehensive, differential, and long-term approach that is child-centric and has a gender focus. So it was a very important spaces to share not only the systematic problem that we are claiming before the Human Rights Committee, but also how this systematic problem is also related with the lack of data, and how we did an effort to collect it, and actually the Inter-American Commission include in its annual report data from the information we presented, and reiterated its call to states to protect girls from sexual violence and ensure the provision of sexual and reproductive services during pandemic. So this is just an example of what we have been working in response to the devastated impacts that this pandemic is having on girls and adolescents' life, health, and integrity in the region.
Thanks so much, Carmen, for bringing that perspective to the floor. And, you name very specific violations that were exacerbated during the pandemic. And we've heard not only from you, but data from other colleagues working in the field. And I really appreciate that you brought also the human rights system into the discussion, even when we discuss, about sustainable development and access to health and inequalities and so on, to show the breadth of tools that we have to fall back to, especially now with the pandemic, bringing up, putting light on the issues that we've been dealing with. We will get back to more details in the questions, especially I want to hear about the data that you were mentioning. So now our last speaker for today, but definitely not the last least, we have with us Asif Saleh, who is the Executive Director of BRAC Bangladesh. And first of all, congratulations on all the work that you're doing. I had a look at your website before preparing for the panel, and I think there is a lot of lessons to be learned from your work. So I'm happy that you could join us here. So if you could share in the time that we have allocated the main lessons that you have from the COVID-19 crisis when it comes to ensuring that the systemic inequalities that were present before have not been forgotten in the COVID-19 response. And I know that you focus on empowerment of girls and women and fighting gender-based violence. So if you could focus on that, I would really appreciate that. The floor is yours. Go ahead.
Thank you so much, Mika. Your Excellencies, guests, panelists, wonderful to be here and hear stories from different regions, but it's very similar across the board, I think, in this part of the world as well. So, and all of you are aware that Bangladesh has been touted for many of its social development achievements in the past 50 years. This year is the 50th anniversary of our independence. I mean, it has done remarkably well in terms of reducing poverty and achieving a lot of the social indicators. But inequality was rising rapidly when the virus actually hit, and with the prosperity. And now we are suddenly in a situation where pandemic has put years of progress in jeopardy. And so we have a lot to do in the coming days. I mean, just to say a little bit about BRAC, thank you for the kind introduction. I mean, it originated in Bangladesh right after the Liberation War, and now works in 11 countries in Asia and Africa, and with almost 100,000 staff, reaching 125 million people. It is one of the largest NGOs in the world now working for sustainable development. So our sort of like big lessons, if I can call it, in this during this one, and we are still very much in the middle of it. As I say that, I mean, we are in the middle of a very strict lockdown. It's at an all-time high infection rate. So we are still tackling this, but let me sort of give you 3 top lessons that we have identified as we were working on this. First one is, I think this has been mentioned before, but this is also some grounded lessons around, we need to keep the most marginalized at the center of the intervention. And I mean, crises affect everyone, but those effects are not equal. And we were under the same storm, all of us, but not on the same boat. So our role was to support those who did not have the boat. And what was evident, what was important to note is that historically, this has also been the reason Bangladesh has done so well in development, having that pro-poor focus where governments and CSO actors work very closely together. So while there was policy cover and resources allocated from the government, CSOs ensured that services reached the doorsteps of the community. So during COVID, we did the same. I mean, in many cases, for example, the government ensured the kits, we provided kiosks and workers to ensure that testing is decentralized to reach the marginalized communities. For some slum dwellers, we, along with our partners and 40,000 health workers, we ensured that support through telemedicine and food were there in COVID infected, so that the COVID infected patients actually stayed home. Government ensured education through television. We helped with the content of distance education. Government announced a stimulus for small entrepreneurs. Our SME banks supported to ensure that they are easily available for the right people. And make no mistakes that this has been like a multi-directional storm. I mean, an attack on lives and livelihood both. While we would love to have shut down the country with one case like in New Zealand, but we couldn't afford it. I mean, we have 85% of our people working in informal sector, and we didn't really have a very strong social protection system as well. So support had to be quick and immediate. People needed to be identified. In the initial days, people were only thinking about saving lives, but in countries like ours, we had to strike a balance between lives and livelihood. So from BRAC, we decided to support provide unconditional cash support to almost 350,000 of the most marginalized families by our own contribution, crowdfunding support, and we did it through digital wallets. And that was a very interesting innovation, which I'll talk about later. And then, I mean, this support mainly went to the people who were living in urban poverty, mostly reliant on daily wages, and they were left with no income sources when the lockdown hit them. Women, we always sort of prioritize women, keep them at the center of our focus, as you mentioned, Mika. And they were disproportionately the brunt of not only the family toll, but at the household chores, working, having, and all of that. And then also violence actually increased significantly. There were mental health challenges, and these were not new challenges, but this has been exacerbated many times by economic stress, preoccupation, closure of courts, safe homes, all that really made things worse. So we provided dispute resolution services, we provided mental health services, and supported women-led households with utmost priority. So our focus remained on people with a situation of pre-existing vulnerability. And last year, we were not only dealt with pandemic, we actually had one of the, like a big super cyclone and one of the most longest lasting floods as well. So this is a kind of like, I think, a trailer for what's gonna come, like with the climate change that are coming in. I think we have to deal with these kinds of crises, both natural and man-made. We also are sheltering almost 1 million refugees in Bangladesh. So the second lesson, obviously, is while we support the most vulnerable, we need to look for new emerging vulnerability as well. So this is the people who were in the new sort of on the small wobbly boats. So our research showed that 14.8% of Bangladesh's population fell below the poverty line as the result of the pandemic. And this group, 1 year since the crisis, 50% of these, what we call them, the new poor, remained in poverty. And this is not a homogeneous group. So this included garments workers who have been laid off because of lack of orders from the West, migrant workers who have returned from abroad without jobs or with little or no savings, restaurant workers who got laid off, and without a social safety net, a lot of them decided to become reverse migrants and they went back to their villages. So as these were people not in poverty prior to the response, they were not included in the existing support system of the government and did not know where to turn for support. So there was confusion on the part of providers as they did not fit existing profiles, and for actual people, there was stigma attached to asking for help. So these also, I think this is the group, the new emerging group which needed support. So third lesson was that building the plane as you're flying it, and to do this with a wide array of partners. There was no right answer. I mean, nobody knew what was happening and how things would unfold. And this had to be done very quickly. Responses had to be flexible. Systems of targeting had to be done quickly. So we tried many different things. I mean, we kind of got together a wide array of partners with the government, the telco operators, the UN agencies, all came together to create a system where not only we were using data, we were using technology, and we were using like the barefoot community health workers to ensure that support is given. So everything was happening, and we didn't really had the right answer, but we were trying all of this. There was this digital health platform where really kind of expanded, and school shutdown happened. We looked for feature phones and other kinds of support that that we could do. So it's a lot of collaborative effort. Digital financial services took a huge, reached a new height. So I just want to say in conclusion that it's crucial that we focus on strengthening resilience. I mean, as the start of the new decade indicates that disasters are going to be part of the new normal. So we just want to ensure that we identify entry points and start working together to ensure that people who need the support are reached quickly and efficiently. Thank you. Thank you
so much, Asif, for those very, very concrete points. And I forgot to say it when Elizabeth was speaking, but you went to the climate crisis as well, happening at the same time as we face COVID. And I think that obviously we need to keep in mind as well when we provide response and support. And also, it was mentioned before, it's not only about, COVID crisis in sense of health, that people were getting sick or are getting sick, but also the mental health impact that we are experiencing with lockdowns and losing livelihoods and so on. So thank you for bringing those issues forward, as well as, that our response needs to be people-centered. And I think all the speakers alluded to that in different words. So with that, I would like to bring up one question for the discussion amongst you. I don't think we can go through all of them because your reflections were so rich. I really wanted the audience to listen, and as it was mentioned at the beginning, to learn from each other and take this forward. So all of you mentioned data. So I would like to focus on the nerdy data question that we have here. And you all said that, sustainable recovery depends on putting the furthest behind first and identifying the most marginalized groups so that the recovery strategy can be properly targeted and answer the needs of different communities. And you mentioned a couple of those that you focus on. And, already in 2014, the Independent Expert Advisory Group on Data Revolution for Sustainable Development, as you remember, 2030 Agenda is supposed to create data revolution. The report said, to quote, "Data are the lifeblood of decision-making and the raw material for accountability. Without high-quality data providing the right information on the right things at the right time, designing, monitoring, and evaluating effective policies becomes almost impossible." And you know what happens with the pandemic. That showed us that timely and reliable data can be a difference between life and death. So from your example now, dealing with the pandemic and responses and different communities that you work with and different institutions, how do we get over the argument that we hear so often that we do not have enough data to make a change? How do we get over the issue of the lack of data to move forward? And if you would like to address that, please put your video on so I know to call on you. The floor is open. Elizabeth, go ahead. And then Ulrika. Perfect.
Okay. One of the things that we decided in our country was that we were going to believe in certain data and certain information and therefore discard certain other information. And so I think that was a key thing, is saying, making sure that where we're getting our data from is absolutely reliable. In our case, that it was the right scientific information, but also in collaboration with other countries to make sure that we were doing things on the right track. But what some of the things we found in the community, as I was during most of COVID, is that we needed to resource people again on the ground to get to those people who are the most hard to reach, the most difficult to get to test, and the most difficult to subsequently get to vaccinate. And so that was a key thing, is making sure that people who are part of those communities actually was involved in ensuring that those people's voices were heard, but that their needs were actually documented and then added into those national data, because when you're doing a national thing, one size does not fit all.
Brilliant. And that, that connects to what Ulrika was saying about, approaches that we need to really customize to the data that we're receiving and we're looking for. Ulrika, go ahead.
Yeah, no, thank you. And well, I think we have to acknowledge that data is still, a challenge for all of us. There are a lot of things happening. And as we have been developing also the support to countries, as I mentioned, on the socioeconomic assessments and recovery plans, we have worked with the multidimensional vulnerability index with support from Oxford University in a number of countries. So there are a lot of things to learn from that, not least from the Latin American region. But also to say that the most basic issues that we thought we knew how to handle, let's say to do a proper gender analysis as we develop socioeconomic assessments, they're not always working. So we actually, after having received the first set of analysis, we had to kind of turn them back, and we developed together with UN Women also a so-called gender tracker. I put information on that in a link also in the chat function, to see to that we could guarantee that the UN teams in partnership with World Bank and others also had a gender lens as we did the analysis at country level. So I think that the instruments that we put in place are important to remind our teams and partners that we need to have a multidimensional vulnerability lens, and we need to look at gender, but also beyond that, getting into a proper understanding who are actually the groups that are left behind, not least also because of the situation we see with regard to human rights that has also been mentioned here throughout the session. But happy to share more information, and also to share also some links where we have also, of course, started to make use of big data and satellite images also as part of collecting data. So of course, new ways of working, and also our digital strategies also gives us actually a push forward. And I think the assets and technologies that we're developing should be used by others as well. Thank you.
Thanks so much, Ulrika. And I really appreciate the multidimensional vulnerabilities focus. And, we very often, at least within the civil society, we talk about intersectionality and how that impacts everyone, and how it is challenging to collect data in an intersectional way to have the full picture of complexity. And also, I think it was mentioned earlier, if something doesn't work, we need to rework it and try again, and then try again, and then try again. I think there's a song like this. So I think, we can just learn from what we are trying. Thank you for that. Carmen, you had a comment here on the data. Go ahead.
Yeah, very sure. No, I wanted to give some, well, first, I completely agree with my colleagues. But I wanted to give, for example, some concrete examples from our region that exists to overcome this issue, no? And as a means to respond to the state's failure to document and monitor these problematics, no? that I already mentioned. So, for example, our local partners in different countries have developed parallel strategies to monitor and recollect statistical data and information in their territory. For example, in Guatemala, the Observatory of Reproductive Health is a reliable source of information that monitors and oversees the implementation of public policies related to the reproductive health, for example. And in Ecuador, our partner Surcuna conducted a survey to monitor and recollect information about the obstacles to access to sexual and reproductive health services during the pandemic. So these strategies, I think, are key and have proved to be extremely important in order to denounce the situation lived by women and girls, no, in our countries. In this sense, I think that also the importance, for example, of the cases we are currently litigating before the Human Rights Committee also relies in creating awareness both of the substantive underlying issues, but also about the crucial need for accurate and reliable state monitoring mechanisms. That's all. Thank you.
Thank you, Carmen. Do you have, because just to follow, Ulrika is sharing a lot of links and resources, which is amazing. Do you have anything that you could share with us, with the audience? Not necessarily now, but if you could share it with us later so we can forward it later, that would be really awesome to learn from that. Asif, go ahead.
Yes, thank you. I just wanted to kind of highlight one thing that from Bangladesh's experience, it was important to see that not only you need the static data of, say, who are the poor or who needs the support the most, but if you also have you also need to use the data for policy making, because situation is also changing very rapidly, and this is such a unique situation where you would need to be very nuanced in the policy making if you are having to kind of balance lives and livelihood. So that required also getting the right information at the right time. So while on the economic side, for example, government also announced that they were gonna give almost 5 million or 50 million people, 5 million people in terms of immediate cash transfer digitally. So they didn't have the available data of who needed the support. So they collected the data from the local government system, but because they had the data, they collected it digitally, they could validate as well whether they truly deserve the support. And actually a lot of leakages were avoided because it was actually done through a very digitized validation method. Having said that, then there are other cases where, for example, our schools are closed now for 16 months. And the government's policy has been that if the infection rate does not go below 5%, they're not gonna open the school. But we are now 16 months down the road, our schools have not opened for a single day. But there were a lot of, like a big part of the last year, there were a lot of areas in Bangladesh where infection rate was much below than 5%. So the schools could have been opened in those areas. So again, these nuanced policy making could have happened if we actually use data at the right time, in the right places. So I would absolutely agree that going forward, part of the building back better is going to strongly depend on digitally collecting the right data, quality data, and ensuring that we are actually using the right using the data in policymaking as well. Thank you.
Great, thanks so much for adding that. And the other day there was a side event on data and community gathered data, and the richness and how reliable and what's the benefit of that and what it can add, especially in context of the pandemic and when not always the formal ways of collecting data can actually operate. Thank you all for this input on data and sharing your reflections at the beginning. I think, I would really love to have this conversation not being the end of it, but the beginning of our dialogue and the learning and brainstorming on concrete ideas, how to build forward better and create a new, better way of doing things together, especially, combining different institutional affiliations and capacities and access to different communities. So as Henrik mentioned before, we will reach out to you and to the speakers and to the participants after the summer when everything comes down after HLPF to continue the conversation forward. And I will close the conversation for now. I don't want us to stress a bit, but also leave a bit of reflection at the end. And according to the recently released Sustainable Development Report for 2021, I mentioned at the beginning that there were some wins and some changes in a positive way to fight inequalities. So before the pandemic hit, the most significant progress that had been achieved on SDGs was actually recorded in East and South Asia, which has progressed more on the SDG index than any other region since the adoption of the SDG in 2015. And on national level, it was Bangladesh that improved most on the SDG index since 2015. So congrats to Bangladesh for all the work. And with this, I would like to give the floor to Her Excellency Ambassador Rabat Fatima, the permanent representative of Bangladesh to the United Nations, and also a co-chair of the group of friends of SDG 10. Ambassador, you have the floor.
Thank you, Madam Moderator, and let me commend you for the excellent manner you have steered this meeting. Thank you very much. Excellencies, distinguished colleagues, dear friends, good morning, good afternoon, and good evening, everyone. It was an honor to co-host this event with my good friend, Ambassador Cho, and the Dag Hammarskjöld Foundation, and we wish to thank you all for your participation and excellent contributions to the discussion. The pandemic, as we have heard, has hit the poorest and the most vulnerable countries the hardest. The average Gini index for developing economies has increased by more than 6%, with an even larger impact for low-income countries. I'm in Dhaka now, and I'm witnessing firsthand the enormity of the challenges that confront us as we grapple with a new and more serious wave of the pandemic. While the richest countries have already been able to roll out major stimulus packages for their businesses and citizens, the poorer economies are being plunged into deeper crisis. The Secretary General's report on the SDGs progress predicts that they will be pushed back by a full 10 years on achieving their SDGs. Certainly, this will further widen the inequalities in those societies. Like many other developing countries, Bangladesh is also seriously affected by the pandemic. I thank Mr. Asif Saleh for sharing important perspectives from the situation in Bangladesh and on our efforts to recover from the pandemic, especially in the areas of empowering women and girls and addressing other vulnerable groups such as the urban poor. Other panelists have also highlighted these issues from their regions. The government of Bangladesh has adopted a multi-pronged and multi-stakeholder approach. We have made COVID-19 recovery a priority in our current budget cycle. My Prime Minister, Sheikh Hasina, has already rolled out 23 stimulus packages to the tune of US dollars 14.6 billion, which is about 4.44% of our GDP, to overcome the negative impacts of the pandemic. We have placed the most vulnerable section of our society at the center of our efforts, with a focus on women, the ultra-poor, ethnic minorities, people with disabilities, and other vulnerable groups. Dear colleagues, yet no single country can tackle this crisis alone. As we move along in this difficult journey, we wish to learn from the good practices of other countries in comparable situations. We need global solidarity to chart out a sustainable and resilient pathway that will ensure equal recovery from COVID-19 reality for all. We have heard excellent perspectives and presentations from the panelists, which have provided us with a lot of food for thought. Allow me to share a few key takeaways. First, the growing vaccine divides between the rich and the poor have compounded the prevailing inequality both within and across societies, and I thank Ambassador Cho for also highlighting that. According to the WHO, while in high-income countries, 1 in 4 people have already been vaccinated, the number in the poorer countries is as low as 1 in 500. We must eliminate this inequality urgently. I reiterate our call for immediate transfer of vaccine technologies to the developing countries. Bangladesh has the capacity, and we are ready to contribute to mass-scale vaccine production if technical know-how is shared with us. That would certainly be a much more cheaper and time and cost-effective option, as you'll all agree. Secondly, the COVID-19 pandemic is plunging millions into poverty and hunger. For the first time this century, we are experiencing a rising trend in extreme poverty and hunger. Perhaps it's time for a new paradigm that would address poverty, hunger, and income inequality in a holistic manner. Thirdly, there needs to be enhanced global solidarity to mobilize more support for climate vulnerable countries. The unresolved issues and unfulfilled commitments in climate financing and technology transfer have exacerbated the inequalities situation in those countries. The upcoming COP26 must come up with concrete deliverables in this regard. In an hour's time, we will be having the meeting of the V20, which my Prime Minister chairs, and we hope to address some of these issues in a more urgent manner. Fourthly, one particularly hard-hit group in the pandemic that I would like to highlight is the migrants. In this pandemic, migrants globally have faced dire consequences due to job losses, salary cuts, forced returns, and lack of access to a social safety net. We are far from achieving SDG 10.7 on orderly, safe, and regular migration. The cost of remittances is still far above then the target of 3%. The pandemic has led to a drop in remittances globally, and many migrant-sending countries such as mine, who are heavily dependent on remittances, are seriously impacted. Remittances remain a key source of external financing and an important driver of upward mobility for many. We need to resolve these issues, address vulnerabilities of migrants, and present further opportunities for them to cope with the post-COVID job market recovery. Fifth, the LDCs and other vulnerable countries are bearing the heaviest brunt of the crisis. They need enhanced support for institution building in the areas of social security, health, and education to fight against the menace of growing inequality. The upcoming LDC 5 conference provides us with a good opportunity to demonstrate our solidarity for an ambitious program of action for the LDCs. Sixth, financing for development, as Ulrika also very well articulated, is shrinking. Not only ODA, but also other sources, including private investment and financing. Many low-income countries are in extreme financial constraints. Some are on the verge of debt distress. Resources are being diverted from SDGs implementation to immediate needs of pandemic response. The World Bank, IMF, IFIs, bilateral development partners, and others must step up their efforts for enhanced financing, especially now that we have entered into the decade of action and delivery. Finally, dear colleagues, inequality is a multidimensional and complex issue. It cannot be addressed in a vacuum. SDG 10 has deep interlinkages with the other SDGs, such as on poverty eradication, hunger, gender equality, health, education, and job creation. Particular attention now needs to be given to strengthening health, including mental health and education infrastructures. We need a holistic approach to realize an equal and just world where no one will be left behind. Finally, the need for reliable and disaggregated data cannot be underscored more. Data would be critical in ensuring targeted response and recovery measures and appropriate policy measures. I shall rest it here. Thank you very much. It has been an excellent discussion, and we look forward to continuing our discussion. As you said, Mika, earlier, this should not be the end of it all. This should be the start of our discussion and continued collaboration as we endeavor to build back better, stronger, and more resilient from this crisis. I thank you all.
Thank you so much, Ambassador, for your remarks and, the specific points of what we should be thinking about. And specifically, I would like to, highlight and thank you for mentioning migrants, because the community is so often, falling between cracks. And even, in the discussions about the ministerial declaration and HLPF, that has been a really heated conversation from my understanding, where member states cannot necessarily agree on that, as well as that SDG 10 is linked to everything else and every other SDG, and we cannot look at them in vacuum. So thank you so much for those reflections, and I really look forward to continuing our collaboration in that field. So thanks a lot. And lastly, before I close, I know that Ambassador Shu Kyung would like to also address us before we leave. So Ambassador, you have the floor. Is the connection working?
Yes. The host should allow us to start the video. 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。 。
Okay.
。 . 。
Ambassador, you have the floor. Is the connection working?
Yes.
there you go. Perfect.
Good to meet you, finally.
Very good to meet you.
Well, again, technology matters. I came to my mission and now I'm connected. Well, I think today's meeting all around the world has made us to enhance the awareness of the importance of this issue. And I have become more optimistic than before because I was able to listen to you, and I'm convinced that there are ways to reduce the inequality all around the world. There are ways to mitigate the situation, if not resolve them completely. So as Ambassador Fatima has said, this should be continued. We have to work together at the United Nations and each and every capital of member states. Thank you very much.
Thank you so much, Ambassador, and we really need the optimism. So thank you for bringing that energy to the room. And I think with that, I think we have plenty to think about, plenty to collaborate on. And on behalf of the three co-hosts, I would really love to thank all of you for joining the conversation. The speakers, you were fantastic. I could continue for many hours this conversation. So hopefully we can do it again. So thanks a lot for joining us. The audience as well for choosing to spend the 90 minutes with us, even though you could have chosen other events. And also lastly, our interpreters who kept working throughout the work. So thanks a lot for joining, and enjoy HLPF, and good night. Bye, see you again.
Thank you, everyone. Thank you very much, Mika. Thank you, Ambassador. Thank you.